Okay, so in this section, we're going to be going deeper into the implications of art and creative expression when put into the context of brain plasticity, some therapies that can be used, and perception. I'll be examining this through the medium of drawing. Some of the learning goals for this cognition in the brain will be, after watching this video, hopefully we should be able to explain the neurological processes that take place in the brain during painting or drawing, and understand what specific areas are activated when engaging in these tasks. Some key terms would be cognitive drawing, perceptual drawing, externally and internally cued stimuli, and cingulate cortex. Some facts and concepts that would be important to remember or to realize by the end of this video would be that artist experience, so like the level of the artist experience and the activation levels of facial recognition areas, have an inverse relationship, and we'll see why in the following slides. Sketching faces and geometric shapes activate different areas of the brain, and skilled artists experience a higher order of interpretation when drawing. So, when we think about what it feels like to draw a picture as a little kid or any stage of life, we're completely unaware of the complex neuroprocessing that's happening within a very short period of time. Some of the key processes are things like visual perception, sensory reasoning, and aesthetic evaluation. These are just some of the key factors that take place during these tasks. And the neural control of various drawing tasks is something that's been well researched, including one using drawing in clinical applications. Scientists have studied in the ways which drawing tasks can enhance neuroplasticity to correct some neural deficits. The first study we'll be examining is how writing compared to drawing tasks for people with aphasia helped them with this condition. And aphasia, which we learned, is the inability to comprehend or formulate language because of lesions or damage to a specific area of the brain. And the study found that drawing enhanced accurate naming responses more than writing of the names of these objects. So again, the goal aimed to compare the usefulness of drawing as opposed to writing as compensatory strategies for improving naming in individuals with aphasia. Some of the methods that they used, they recruited 22 individuals with left cortical lesions, and they were subjected to engage in a naming task of 30 like household items that were found to be acquired by the age of 7, to like a rug or a fan or things like that, something around the house, that simple items that you should be able to know. And then the participants were then asked to either write or draw some of the items that they had been just presented to and prompted with the question, what are you drawing or what are you writing, like in that moment? And the results suggested that drawing facilitated the naming at a better rate, whereas writing diminished the accuracy naming of responses. And the drawing quality wasn't relevant to the effect. So like if I'm a bad artist, but the act of physically drawing it would help me make that connection better to what the name of the item was. So another point of interest is how different types of drawing can have different activation centers in the brain. For this, we'll now examine a study that compares and contrasts perceptual versus cognitive drawing, which is drawing what you know versus what you see. So abstract art is mainly associated with imagination. We're coming up with new shapes and patterns and connections as we're drawing, whereas portraiture, so like copying, was right in front of you. So I imagine Leonardo da Vinci was just drawing a picture of a face house sitting right in front of him, not knowing it would be one of the most famous paintings in history. So that's pretty cool. And this addresses the question of activation in imagination versus interpretation. Yeah. So another study, the brain, drawing on the brain. It was a meta-analysis of functional brain activation. One of the goals of the study was to identify and characterize the brain regions that are consistently activated during the act of drawing and examine the functional connectivity between brain regions activated during drawing. So looking for neural patterns across the brain as well as specific regions. Some of the methods they use fMRI and investigated this activation and reported the coordinates of the brain activation during drawing. And some of the results, we see that cognitive drawing, so this is drawing from imagination, drawing from your head, thinking of your own ideas and presenting it on the paper, was associated with prefrontal and cingulate cortex activation, whereas perceptual, so that would be like copying an image or even tracing an image, portraiture, things like that, still lifes, that would be drawing, was associated with cerebellum, frontal, and parietal activation. So to give more of an in-depth definition, so we see cognitive drawing activation, or cognitive drawing had activation in the prefrontal cortex, which is to do with reasoning. So imagine that you're drawing something from your head and you think, okay, well, how would this look best on paper as it does in my head? And then cingulate cortex, which linking reward and punishment. And then we have perceptual drawing, which is drawing from what we see outside. So this is considered externally cued stimulus. Associated with this activation of cerebellum, so fine movement coordination. So think of like, say I'm trying to copy an image exactly like as it appears right in front of me on my own paper. It requires those fine movement coordination. A frontal lobe, executive functions, so capacity to plan. So something like getting proportions right on the face would have to do with the executive function, such as capacity to plan. And the parietal lobe, receiving and processing sensory input. So we see something in front of us through a visual cortex, goes to the motor cortex, and is involved in the receiving and processing of the input that we get. So moving on, we have how different experience levels when drawing affects activation in the brain as well, drawing different subjects. So faces versus geometric shapes or landscapes. So this fMRI observation showed that artist experience levels of facial recognition areas have an inverse relationship, and that sketching faces and geometric shapes activate different areas, as well as the fact that skilled artists experience a higher order of interpretation. So the fact that skilled artists, when copying a face or drawing a portrait, they can sense the nuances in the face rather than the shape of it itself, rather than unexperienced artists. They are going purely off of what they know how to do, which is not to the level of the artist. So copying the lines that they see rather than interpreting the face and how it would look best in certain lighting and certain position on the paper, things like that. So it's that higher order of interpretation for skilled artists. In conclusion, this presentation hopefully closed the gap between art and science, as we are seeing many studies do. We now know the difference between internal versus external stimulus. So internal things coming from your brain, imagination, and cognition versus external stimulus, things we perceive and get input from the outside world. And we saw how experience levels affected different areas in the brain and had different activation areas in the brain. Thank you.